chose to write my paper and do my presentation on alternative cancer therapies. The actual definition of cancer is a disease caused by an uncontrolled division of abnormal cells in a part of the body. And according to the American Cancer Society, in 2019, there were a total of 1,762,450 new cases of cancer amongst men and women. Unfortunately, as medical journal articles have confirmed, the outlook for most people diagnosed with cancer today, with some exceptions, is not much better than it was a generation ago. So we typically think as time goes on, technology and medicine gets better, but with cancer, that's not necessarily the case. So if you are diagnosed with cancer, a typical treatment plan would be to have surgery and either chemotherapy or radiation therapy. But there's also other main options, which is bone marrow transplantation or gene therapy. Clinical trials are also a big thing, more with terminal patients than those who are deemed curable. Since they are still in the trial state, it's not necessarily sure how it's going to react to every cancer, but clinical trials do give researchers better ideas of how to treat people with cancer. They break down cancer therapies into 4 categories, and the first category is machines and mechanical devices. This basically just restores harmony in the body. The second category is drugs, medicines, and other biological products. The third category is your metabolical therapies, so it's detoxification, having high dosages of vitamins, minerals, and enzymes. And the fourth category is your spiritual, mystical techniques, and religious faith. So there are 5 main alternative cancer therapies, and this first one is IPT, which is insulin potentiation therapy, where they drop your blood glucose levels to where you now have a mild case of hypoglycemia. The cancer cells then are deemed hungry, so they give you 1/10 of the dose of a normal chemotherapy dose, and the cancer cells then absorb them and die. The second main therapy is Iscador, also known as mistletoe therapy, which it's just purified mistletoe extract, and it kills the cells while also building your immune system back up so that it can defend itself. The next therapy is Gerson therapy. This is a detoxification, so it is a strict alkaline diet. It also deals with juicing, coffee enemas, and different supplements. It restores the body's immune system and its defenses. This next one, Ukraine, is a drug. It contains 40 alkaloids and is quickly absorbed by the cancer cells, causing them to die. And the last one, biomagnetic therapy, has multiple names like biomagnetism, biomagnetic pair, terrain restoration therapy. It deals with the positive and negative poles on magnets that are placed over vital organs, and this is to shift the natural pH and restore biological balance. So there are many things that become factors into deciding to use alternative therapies or not. Age is a big one. The older you get, typically the less likely you are to use them. And beliefs about the treatments, if you think that they would work or if you're skeptic about them. If you are encouraged to use them, you typically are more likely to use them. And really it comes down to your personal lifestyle and your choices. Relatively little is known about the rate of the alternative therapy use and reasons why people with terminal cancer may choose to use an unconventional or alternative therapies. So really, alternative cancer therapies are still up in the air, just like anything with cancer. It's really unknown, but it really comes down to the patient's lifestyle and their choices.